Hi everybody, it's Dr. Eric Balcavage and welcome back to my website on natural thyroid solutions. Today we're going to talk about another hidden cause of thyroid symptoms that your doctor probably never told you about. So today I think we're on number 4 and we're going to talk about dopamine, which is a neurotransmitter in the brain. Essentially, if you remember from another video, your pituitary gland releases a chemical called thyroid stimulating hormone, and you'll probably see TSH on your lab test. It's the most common marker used to evaluate thyroid function. Matter of fact, sometimes it's the only marker used to measure thyroid function. And so TSH is released by the pituitary gland based on demand from the cells of the body. TSH goes to your thyroid and stimulates the thyroid gland to actually produce thyroid hormones. The problem lies is that if you don't have appropriate dopamine being produced in the brain, it'll affect the amount of TSH that can be produced. Now, it'll decrease the amount of TSH produced. And the problem here is that your TSH level will be suppressed below functional range, but not below lab range. So your doctor may be looking at those lab values, and I told you about those lab values before. So, for many conditions or for many of those markers, lab values are just too wide to really pick up problems. And in thyroid conditions, there's 24 thyroid patterns. They're definitely too wide for picking up those 24 thyroid patterns. So in this situation, TSH will be within lab range, but it'll be below functional range, because with dopamine, not enough dopamine being made, there's not enough TSH being produced, so it'll be below functional range. If I don't have enough TSH being produced, I'll have decreased thyroid hormones to a degree. So in this situation, we're looking for a low TSH level below functional range, but within lab range. So the question is, if it's dopamine that's causing the problem, how am I going to know that? Well, if it's a dopamine problem that's causing your thyroid symptoms because it's suppressing the amount of TH being produced, how do you know? Well, we don't typically test for dopamine in our practice. What we do, we use neurotransmitter or neurotransmitter questionnaires, so some history questionnaires. But the person may have symptoms like worthlessness. They may have a hard time focusing or maintaining their focus. They may have a sense of helplessness. Symptoms often associated with people with ADHD. If it appears that dopamine is the problem, what do you do? Well, typically we want to find out what would be causing the dopamine not to be being produced appropriately. And most times it's a blood sugar dysregulation. You're not regulating your blood sugar appropriately, and it's having effect on hormone production, namely dopamine in this situation. So we'll have decreased dopamine production, so therefore we'll have decreased TSH production, and the person will start to have thyroid symptoms. But remember, your TSH level will be within lab range, so your doctor probably won't pick this up, yet you'll still have symptoms. They may tell you need maybe some medication, and anxiety medication, because you're having symptoms of anxiety, stress, irritation, lack of focusness. So they may want to put you on a Ritalin-based medication. They may want to put you on an anxiety type medication for those symptoms, but tell you that your thyroid's normal. So I hope you learned a little bit from this one. Dopamine is hidden cause number 4 of why you might have thyroid symptoms that your doctor never told you about. I hope you'll come back for another edition of the hidden causes. This is Dr. Balcavage. Remember, if you have any questions or if you want more information, click one of the information boxes and you'll get a DVD on our Natural Thyroid Solutions treatment program, or you can always call the office for a discovery visit at 610-558-8920. Take care.